Hey guys, it's me. It's the 7th, and I know it's been a while since I made my last video. The reason for this is I've been depressed lately, and it makes it pretty hard to function. But I'm doing okay now. I'm really glad I pushed myself to do this video today. Being that my appointment is right around the corner, it's Thursday the 11th, I've decided that I'm going to give you guys as much information about the surgery as possible in a limited amount of time. I don't want to make a half-hour video because then you guys are basically watching a movie. You might as well just pull out the popcorn. The first thing I'm going to address is the fact that a few people have asked me, where are you at in your procedure? I guess I've never really made it clear. I even had one friend who thought I had already had the surgery. So, just to clarify, there are 8 steps total in the program. I am on step number 3. The first 2 steps are basically just attending the seminar and getting your insurance's approval. Step 3 is attending the new patient consultation day. Step 4 is completing the pre-op testing and psychiatric evaluation. This is basically just to determine if you are in the right mindset to go through with this, and not only the right mindset, but also that you're physically healthy enough to go through with it. Step 5 is attending the review day. This basically just determines whether or not they're going to pursue it. The step that I'm on, I'll go see the doctor and they will decide, is surgery right for you? If they think that yes, it is right for me, then I move on to step 4. When I get to step 5, this is when they either give me the green light, which means I set my surgery date and I'm ready to go. They give me a yellow light, which means they want to proceed, but they're afraid that I'm not quite ready to go through with the surgery. Then they'll send me for more testings, more evaluation, and then from there they'll move forward. If I get a red light, this means I'm done. They're not going to move forward probably ever. I think the time period is 3 months. If you get a red light, you have to wait 3 months before reapplying, and at that time they'll review everything, but that still does not mean that you'll get let back into the program. So this is really where they determine whether or not I'm even going to be able to have surgery. Then after that is step 6, which is the final pre-op day. This is where they give me all the information before I go into surgery. I believe that day is in the hospital. I'm not 100% sure. I guess I'll find out on consultation day. And then step 7 obviously is day of surgery, and then the last step is post-surgical follow-up and support. This is just to make sure that everything goes smoothly, transitioning from the life I'm in now to life after surgery, and also to keep up with me to make sure that, I'm that I'm staying healthy and that everything is okay with me. They also have a support group that is for people that have gone through bariatric surgery, for them to meet with other patients who are struggling with the same things that you're struggling with. So that is the step process. Like I said, I'm on step 3, so I've still got a little way to go, but like I said, my appointment is Thursday the 11th, and I'm really excited. The other thing that I wanted to address is, I guess I've confused a few of people about what procedure I'm having done. I guess a couple of you thought I was having lap band done. Now, for those of you that don't know what lap band is a plastic band that they put over your stomach and close it. Not all the way, but they pinch off most of your stomach to basically make you fuller faster. This is temporary, it is removable, and the success rate is not very high. No, I am not having lap band done. There are 2 types of actual bypass. The first one is Roux-en-Y gastric bypass, which this is what it looks like. As you can see from the picture, they separate separate the stomach from the intestinal tract, and then down here you can see where they've rewired the intestine. That is the one that I'm having done. And then the other procedure is gastrectomy. I'm not entirely sure how to say that word, but this is what it looks like. In this instance, they completely remove this part of the stomach entirely. It's no longer there. That procedure is irreversible. With the Roux-en-Y, here I'll show you again. With the Roux-en-Y, the stomach stays where it is located. It does not move, it does not change, it stays there. And that is what makes the procedure reversible. Because if you remove something from the body, you can't put it back in. And that's one of the things they tell you, is that out of both surgical procedures, the Roux-en-Y is the only reversible one, because they're not actually removing any part of your body. Some lifestyle changes after bariatric surgery. Nutrition for life. Again, this is off of a list that they give you at the seminar. It says, you will be meeting with a registered dietitian and developing a personalized lifestyle plan, which I will be meeting with the dietitian on the 11th after I see the doctor. They help you plan to meet your nutritional needs and goals. Vitamins and minerals will be required every day for life, and protein supplements may be required to meet your personal goals. So this is basically saying that, especially early on in the procedure, when you can't eat a whole lot, I actually think the first 6 months is no rough foods, which would be meats, because they're harder for your stomach to digest. They give you protein supplements to make up for the fact that you aren't getting protein from meat. There are other sources of protein: beans, peanut butter. Some yogurts are high in protein, cheeses, things like that. So there are other sources of protein outside of meat, but a lot of times that's where you get a majority of your protein from. Moving on, regular exercise for life. It is important to develop a regular exercise routine before surgery and continuing after surgery. Physical activity plays a vital role in protein utilization, weight loss, and overall good health, which is true. I would like to address this part of it by saying that I have been exercising. I am doing a kickboxing exercise, which some people are like, kickboxing? What? You? It's actually easier on my body than running or walking or jogging, because it's pretty much stationary. I am working out my legs, but I'm not hurting my knees very much. For those of you who don't know, I do have bad knees, mainly because of my weight. So the kickboxing helps. So I have been doing that. I have been exercising. It's hard, but I feel really good afterwards, and I've been sleeping a lot better, so that's a positive. Next part is medications will need to be adjusted. Because of the process, skipping a lot of the absorption from your food, a lot of your medications don't work the way they should anymore. A lot of blood pressure medications, heart medications, cholesterol medications, these don't work the way they usually would, because the medicine isn't being absorbed the way it's supposed to be absorbed. So a lot of times they have to either lower the dosage or increase it in order for it to work. This also would remain the same for depressional medication. I am on Wellbutrin. I don't take it like I'm supposed to. Don't tell my Mainly because I forget to take it. But this would be one of the medications affected by the bypass, which means they would have to test it out, basically. Ibuprofen, Advil, Aleve, naproxen, Nerprin, these are all NSAIDs or aspirin products, and they do not want you taking these. These are no-nos. These are bad for you. They want you to stay away from them because they can cause ulcers and internal bleeding, which they don't want. So they tell you to try to avoid them. You have a higher risk of GI bleeding, ulceration, or perforation because of what you're, it's going to be sensitive, it's going to be weak down there, so you just kind of have to, work around it. Diuretics, basically, you have to limit your use of diuretics, plain and simple. I'm not on diuretics, so I don't have to worry about that, but I do know a few people who have been considering this surgery who are on diuretics, and I would, tell you, you definitely need to talk to your doctor before you pursue it, just because one of the things they tell you in here is that there's a risk of severe dehydration, and it can cause a lot of problems. So, and then no smoking prior to surgery or after. I don't smoke, so that's not a problem either. To give you guys some numbers, because I've also had people ask me, what is the difference between the surgeries? I have talked about the success rates, and, sorry, I was moving. People have asked me, you have talked about the success rates, but, how do we know you're not just throwing random numbers at us? And I've even had people who have done research who have, thrown their own figures at me. This comes from the hospital. These are their numbers, not just their numbers, but these are the national numbers that come from the Metabolic Institute. So, right here,